Hi, FirstLight family. This is Paul Jones coming back to you with our weekly update on the coronavirus crisis and our response to it. I want to keep you up to date on everything that we're doing, anything that we're seeing, and provide you with some reassurance on how things are going here at FirstLight. So I am going to do these weekly. I think I told you last week I was going to try to do them on Mondays, but the information is coming so fast and changing almost every day that I wanted to wait to get you the most up-to-date information. So I'm going to look down at my notes to make sure I cover everything I want to talk to you about. One of the first things I want to make sure that all of you understand is that we are open for business. We have been from the beginning. I think we're about 3 weeks into managing this crisis with all of you. And other than increasing some of our infection control practices, nothing here has changed. So we're available 24 hours a day, 7 days a week. Our caregivers have been amazing. They are all out doing great work with all of you and serving the community. And I want to make sure you understand that your services will not be disrupted in any way. I know the governor made an announcement recently to close businesses in the Commonwealth, except for essential businesses. And because we are in healthcare, we are an essential business and we will be here for you. So there will be no disruption in your care whatsoever. I also want to make sure that you understand that we are still following all of the CDC guidelines. So the Centers for Disease Control, and you're probably, those of you that are watching the news, you're seeing the press conferences are coming from the coronavirus task force and all the information they're putting out. Whatever those national guidelines are, that's what we're following. And so we are practicing social distancing when we're out in the community. For those of you that are receiving services from our caregivers right now, you've probably noticed that we're not going out to the grocery store and doing those sorts of things. We in the office are taking that responsibility on to help you. So we've figured out a way to go out and get groceries you need, to get medications that you might need, and then deliver them to you in a contactless delivery. Excuse me, that's hard to say. A contactless delivery system. So we would call ahead to either you or your caregiver, let you know that we're on the way with the things that you needed, leave them at your door, and then you can pick them up and not have any concerns about having contact with someone if that would be a concern to you. Particularly because we're going out in the public getting things for you. While we're out there, we are practicing social distancing to keep everything safe and make sure that we're not promoting any kind of disease transmission whatsoever. Point is, if you need something, and whether errands is not part of your current care plan, or maybe you're not receiving services right now, it doesn't matter. Give us a call. Matthew, Leanna, or myself, or Renee will go pick up whatever it is you need and bring it right to you. No questions asked, okay? So, and understand that while we do those things, that we are continuing to follow all of the guidelines from the CDC. And then lastly, we want you to understand that during all of this, you can expect the same quality of care from us that you've come to expect and appreciate. We're not changing any of our practices in terms of doing caregiver introductions for new folks that may be coming to visit you. The one thing that we are doing is we are limiting quality visits or what might be unnecessary visits to your home that aren't really medically necessary, that don't involve your care that you need today, just to keep the number of people coming in and out of your house to a minimum. Your caregivers coming into your house, however, is still just as important as it was when you started working with us. So we really encourage you to continue to take advantage of that, to make sure that you're not putting yourself at risk by scaling down services when this is a time when you need somebody coming in and checking on you and making sure that you're okay and that you have everything that you need to stay safe and comfortable in your own home. Those are the big things I wanted to make sure you knew that we're doing, and that we are continuing to monitor this situation literally hourly every day. We have FirstLight offices all around the country, and we are meeting daily, hundreds of us, to share ideas, best practices, and to make sure that you are getting the best possible care, and that we come out on the other side of this better for it. To that end, I want to do one last thing, and that's point you to our website. So if you go online and you go to, just go to woodbridge.firstlighthomecare.com, and that will take you to our webpage. And I don't know if you've been to our website before, but there's a lot of cool information on here about what we do and how we do it. But what I want to draw your attention to is here at the top. We have a new banner up here for information regarding the coronavirus. So if you will click on Learn How FirstLight is Here to Help, it's going to take you to a special page that we've set up for you that explains to you exactly what we're doing in great detail, all of the information about the steps that we're taking to keep you and your family safe and to keep our caregivers safe. I would particularly want to draw your attention to this top section. I am going to be going in here and updating information as it changes. So you can see the newest information is going to be in red, and this is going to change based on when the information comes out. So this particular part right here was new as of yesterday, and it has to do with Governor Northam's executive order. And if you want to actually see it, you can click here, and it's going to open a page and take you to the text of that order so you can know exactly what's going on. We understand that it's important to have reliable information during this crisis. There's so much noise out there. Where do you go? Well, we wanted to make that easy for you. So if you simply go to our website, click on that banner at the top, and go to this page, you can trust that the links that we have here, not only these are the guidelines that we're following, but this is information that you can trust to keep yourself safe and your family safe. So, for example, if you want to know how to protect yourself, you just click on this link, and it will take you straight to the CDC website and understand how the coronavirus spreads, how to protect yourself and to protect your family. Some other things, if you want to know what the symptoms are, just click on there, and it will take you straight to that page where you can learn more about what the coronavirus symptoms are. And then if you have other questions that we didn't specifically address, you can go here, and there is the frequently asked questions section on the CDC website, okay? And then here is more specific information for you that's unique to us here at FirstLight. I keep talking about our infection control processes. If you want to know what those are, we want to be fully transparent and give you all the information that you could possibly want. So you just click here, and you can read, if you want to, all 52 pages of our infection control manual. And it talks all about how we handle communicable diseases, so that you can rest assured that we're doing the right thing for you and your family, okay? We also have on there links for Prince William County emergency information, specifically what's going on with the public schools. The Virginia Department of Health, they have an interactive map and official information. So if you go there, you can see exactly what the outbreak looks like in Virginia, which counties seem to be the most affected. And as we're not surprised here in Northern Virginia, because we have a greater population density, we're going to see probably more transmissions in this area, that sort of thing. And then of course there's an interactive map with Johns Hopkins. And then down here, I am going to be, when I do these video updates or any emails to you, there's going to be links to all of those here. So if you just click on any of these, this is the first email I sent out a couple of weeks ago. It'll take you straight to that. And then last week's video update, and then of course this week's will be out there too. So we really wanted to create a one-stop shop for you for the information you need. And all you have to do is just go to our website. Go to our website, once again, click on that banner at the top, learn how FirstLight is here to help, and any new updates that we have in between these video posts will be right there for you. If you read something on there and you have questions, there's a link that you can contact us, but you really don't have to do that. You know how to reach us. Just pick up the phone and give us a call, and we're here for you 24 hours a day, 7 days a week. We are going to get through this together. We are positive, we are optimistic, and most of all, we're grateful for the opportunity that you've given us to be able to walk alongside you and your family and be there for you when things really unexpected come along. So thank you and have a great day.